Hello, my name is Teh'Rhon Rabsatt. My mentor is Dr. Mark Boumediene, and my presentation is on modeling infection rates in the US Virgin Islands. So when I started my research, the research problem I was attempting to solve was creating a model that could allow people to model infection rates in the US Virgin Islands. And so the three big problems I was hoping to solve was figuring out data sources, because we have a lack of data in the Virgin Islands, figuring out the model parameters one would need to use to simulate the actual infection rates in the Virgin Islands, given our local population and culture and whatnot, and error rates. How likely would your model be wrong, or how likely would your model skew away from the ground truth? So the methods I used was collecting data, creating a model, testing out different models in different test scenarios, and effectively testing those scenarios against the ground truth. But that also meant that I had to figure out exactly what the ground truth was, so I could figure out how best to simulate my model against the ground truth of reality. So data I collected in creating my model, which my model I'm going to use for my model, I was going to be using the COVID-19 virus and pandemic, because it is the most recent virus that exists, and it's a current problem, so that does also give me an incentive to try and create this model. So data I collected came from the 2010 census, which I know there is a census taking place this year, but the data I have was based on that census. So using population, density of the population, the average household size, job types. So I basically picked out job types that I found to be most susceptible to illness, disease, injury, and whatnot, and average household income. And then I compared those data sets to the data I collected on COVID-19, which age groups were highly susceptible, the transfer vectors for the disease, the minimum transfer distance, which is how close an individual needs to be with each other in order to actually transfer the virus, the infectious period length, which is how long one actually can transfer the virus, and any effective countermeasures. So here's some more of that data that I collected. Over here on the left, I have three different hot maps, and all this data was collected at the time of my initial test, which was during July 12th. Was as recent as the data was when I initially started the test, because when you do a model of reality, simulation and mathematical model, you want to start from somewhere and then go from that point onward and see how likely it is to actually how likely your model actually does predict what takes place afterwards. So with this data right here, you can see things like how likely the community was to transfer the disease, transfer based on close contact, travel, and different symptoms people presented with when they also showed to actually have had the virus when they were tested. So going from there, I would be moving into my model. So I need to explain to you what kind of model I used. And so the model I used was a mathematical model. Most models that are used in these cases to predict viral infections in populations are mathematical models at the end of the day. And so there are basically three different types of mathematical models when you strip them down to their bare pieces, right? And so the first one is a black box model, which is over here on the left. You input data, you put it into a black box, you're never sure exactly what's happening to the data, but you get an output. And you compare that output to reality and you go, okay, I guess it worked. And so up here in the middle, I have another example of a black box model where you have an environment, you take stimulus, you put the stimulus into the black box model, and it gives you a response on how you should respond to your environment. Then down here, you have a white box model, which shows an environment, and then you have a disturbance that you were able to calculate this disturbance. You had the environment then changed, giving a stimulus to the white box model, which inside the white box model, you can actually see exactly how you altered and moved the data, and your goal would be the comparator, which is basically how you change the data to ensure that the output actually gives you a response that is equal to the predicted future that you're trying to capture. And then over here on the right, I have a gray box, which represents a mixture of the black and the white box model. The model I used was a white box model in that the code I got was from GitHub, and it's publicly sourced, so everyone can have access to it, and all the data I got was all publicly available. So none of the data I have and none of the math I used can't be used by someone else. And so once I figured out how I was going to calculate the information, I then needed an actual viral prediction model. And this is where the SIR model comes in, which it stands for susceptible, infected, and removed, which is how the SIR model came to be. It is the most common model that is used in terms of viral infection rates when you're trying to calculate them. And so I started here because it was the most simple and the most easiest to use. You just plug in the information. So for the S, which would be susceptible population, you determine that by the number of people who would be susceptible on a day, which is represented by time, which usually in a mathematical model is represented by T. Then there's I, the number of infected people on any given day, and then and then R, the number of recovered people on any given day. Then you have your beta, which is the expected amount of people an infected person infects per day. So this would basically, your beta would basically be your infection rate. And then you have the number of days you want to see how long the virus was able to spread during a set period of time, and that would be standard by delta, which I have here represented as a capital D. And then down here, there is the proportion of infected people, the proportion of infected that are recovering per day. And this is represented by a lowercase y, which in the actual calculations is represented by gamma. And so susceptible individuals transfer into infected individuals and then into removed individuals once the infection has passed, or the individual has passed, or in the case that the individual dies. How it goes from susceptible to infectious is where this big long equation up here comes into, which is that you calculate the rate of infection, the probability that the rate of infection, the infected population can actually infect susceptible people, and then you also calculate the population from the beginning to the end, which would be the population of susceptible people and the population of infected people, and then you compare them to the brand new population of the newest infected individuals. And so once you go forth from there, you would run test scenarios. So the test scenarios that I ended up running, I ran hundreds of them, and here are two comparisons of how my model started out when I had very little when I started with a bit of information, and I needed to tweak some more of the some of the parameters of my actual model. And so over here on the left, you can see this is my trial 3. It's completely wrong, as it said that from the first day, everyone would become infected and recover instantaneously, and by 20 days in, all individuals who were infected would have not been infected, and everybody would have recovered. Then over here on the right, I have my trial 115, which is actually closer to the ground truth of today, and in it, the population of the susceptible individuals dips down greatly. The amount of infected individuals never grows too high, as individuals recover quite quickly on the island, but at no point in time do our recovered population exceed our susceptible population. This actually showed me one of the errors of my model, which is that modeling it in terms of days, it might have happened too quickly, and I might have wanted to look at modeling it by weeks, but I can talk about that in my limitations. And so then I have my ground truth, and this is the ground truth as of September 22nd. So there's 62 people who are currently active infected based on the total number of population of individuals who were tested, which is 19,479. You can see the recovery rate is 64.8%, and the contact rate is 41.8%. And so in my limitations, I found that I didn't have enough data, and also I had a bad model fit. the amount of data I had was limiting in that I don't have the actual amount of people who have the virus. I only have the amount of people who have been proven to have the virus after being tested. And my bad model scenario fit was that my model could not actually couldn't separate individuals who had just recovered from the virus and people who had actually passed away from the virus, which would indicate viral severity. So in the future, I'd like to test new models. I'm going to give you a couple examples of those a little bit later. And then I wanted to figure out more secure avenues for data sources, because the data sources I had were all public, but there could have been other testing areas, such as more private tests. Private companies could have been testing individuals, and I could have looked into finding some of those who might have been testing locally. I'm not sure that any were, but this is all the data I had at the moment. So finding more accurate data sources that had way more knowledge would have been more beneficial. So some of the newer models I could attempt to try in the future would be the SEIR model, which is like the SIR model, except it calculates people who are susceptible and separates them by people who've been exposed. So this would actually benefit us in terms of the COVID-19, because just because you've been exposed to the virus or someone who is infectious doesn't mean you actually become infectious. But because you've been exposed, you could become infectious over a period of time. But the carrier model down on the bottom actually would prove to be probably the best, because susceptible individuals can become infectious, and after becoming infectious, they might be asymptomatic, which means they wouldn't be able to show infection. So they wouldn't be able to show that they are infectious, but they could still give you the virus because they're asymptomatic, and then that would differentiate them between those and recovered individuals. So here's a list of all my references that I used, and obviously I would like to thank the MARC program and the NIH for providing the funding for me to go ahead and try and do this research. It was really fun. And I'd like to thank Dr. Turner, Ms. Sanchez, and Dr. Mark Boumediene, because he definitely helped me with a lot of the computer science that is required to do the mathematical models. Any questions?